Hello, I'm Stephen Starks, a member of the APA Caucus of Black Psychiatrists. There are significant differences in the rates of access, diagnosis, and treatment for African Americans that negatively impact their health. Let's consider our role as psychiatrists in improving the lives of this patient population, which will involve thoughtful consideration of historical, sociocultural, and individual factors that influence the care you provide. Institutional racism extended beyond the realm of social injustice and the struggle for civil rights. It permeated American medical education, medical practice, and scientific research. It's easy to suggest that racial bias is a thing of the past. Yet studies continue to report that African American or Black patients are 1, more likely to receive their treatment in emergency and hospital settings, 2, misdiagnosed at a higher rate with schizophrenia spectrum disorders, and 3, are less likely to be offered antidepressant treatments, even when they have access to insurance or financial resources. Those are merely a few examples which negatively influence Black patients' relationship with the mental health community. To prevent racial biases towards Black patients, one should consider reviewing theories and practices to see whether they connect with core values of Black culture. Eurocentric treatment approaches do not easily align with family, kinship, community, and spirituality, vital components of Black expression. As psychiatrists, we should examine how perceived racial discrimination contributes to hypervigilance, anxiety, and depressive symptoms. We should understand our biases in care and consider that Black patients may feel dismissed, ignored, and that their expressions of emotions are misperceived even by the experts. So what can you do to reshape your healthcare system, hospital, clinic, your practice to reinvigorate relationships with this community? Start at home. If you only interact with Black populations in a clinical setting, that might be indicative of a disconnect with their identity and value systems, which may reinforce health disparities. Educate yourself on the experience of Black patients in your community. Visit neighborhoods or collaborate with community partners. Scrutinize how Black people are represented in your local press and in the media, and consider how it influences your perceptions. Finally, rather than taking a colorblind approach, be open to the individual experience. Do what we do best as psychiatrists. Actively listen. Critically evaluate each relationship as you build an alliance. Be aware of their strengths and what inspires hope in their lives. Black is dynamic. It's African, it's Caribbean, it's Latin. Black is love, it's family, it's culture. Black is influence, it's science, it's discovery. Black is art, it's prose, it's hip-hop. Black is patriotic, it's liberty, it's justice. Black is American. Remind yourself of the wide array of Black experience in your clinical encounters. To learn more about culturally informed best practices, diversity curricula, and the APA's community programs and partnerships, please visit the Diversity and Health Equity website at psychiatry.org.